Can I try to get us, I think the point of today's meeting, honestly, you two obviously have very different feelings on this, which is, you'll have to discuss that. But today we just need some clarity on what the situation is, and unfortunately the medical person who knows better than any of us in this room is not here. But what we need to talk about is the basic, to me, the ultimate thing that we all share in this room is we're all trying to decide what's the most loving thing to do for this man. And in order to get that, we need certain pieces of medical data, which unfortunately we can't do this morning.
No.
But I think what we're trying to do is set up, to explain to you what we know and what we don't know, and then where are we with that. And then you two are going to have to simply discuss this later about who did what, and different understandings about who's in charge here.
I mean, one of the things that we may not be looking at is this hasn't been status quo. This hospital admission was for multi-system organ failure, renal failure, respiratory failure, and when that happens in a person who's already very debilitated, decisions about DNR have to be made rapidly so that further non-beneficial, hurtful things to the patient aren't done. So it would be very appropriate for Dr. Murphy to speak with...
I don't see sustaining Dad's life hurtful. I don't see that.
CPR might be...
Ask Dr. Murphy or some doctor if you don't trust Dr. Murphy.
Well, if you had called me, then I would have known.
Ask some doctor what CPR is.
Let me start where we are here then, since you are here now, okay? And I mean, I have to agree with Jack. It's a tough situation when you come from different perspectives. Ultimately, Mrs. Abrams has the legal authority to make those decisions. It would obviously be better for the future if there's some agreement on that. For your future, in terms of your family situation in the future. So I think very important that Dr. Murphy be able to speak with you, that anyone else that he's consulted, that he'd feel would be appropriate, be able to speak with you. But I think...
here's the thing, that when Mom died 10 years ago, Dad included me. I was part of all the decision making in that, when actually Mom died. I don't see why anything might have changed with Dad, that he wouldn't want me to be a part of this. Okay? I mean, 10-year relationship with my father doesn't legally make you automatically to say so without having to shut me out. I was always part of it. You say you know what Dad wanted? Well, back then, even before you were even in my father's life, he included me in that decision making about my mother. And that's the way I think Dad would want it now. Okay?
But you have to be reasonable in your decision making.
I am very reasonable. I'm being very reasonable about this.
I don't think you're...
I want to see my father stay here as long as possible. Okay?
What you don't...
Yeah, I think, Jeremy, you brought up a very, very good point, which hasn't been discussed amongst us today. If either of you know, did Mr. Abrams ever speak to either of you about what he would like done if he wound up this way, medically being told there's no hope of recovery, he's being kept alive by machinery as best medically I'm told, we know.
Just that when Mom was around, I mean, we did try and treat Mom, as long as possible.
Right. So about her, but did he ever say anything about himself in a conversation or
how he treated Mom was probably no different than how he would have been, wanted to be treated himself.
But your mother was not on life support.
Your
mother did not have Alzheimer's.
Tell me what happened with your mom.
It was a different situation.
Mom died of cancer.
Mom died of cancer, okay. One of the principles that we kind of look at in ethics is what's the benefit to the person and what's the burden to the person. And so what does your dad get out of it, basically, and then at what cost him? And you do that in different ways. So if I have cancer and chemotherapy is an awful thing, but I go through that awful thing in order to have more years of life. And you have to weigh that out. So,
well, could we ask him,
yeah.
Did you ever have a conversation with your husband for the last, 10 years or so?
No, he's had Alzheimer's for the last 2 years. He's been progressively,
Okay.
So it's really
So
not
been a discussion.
It has not been a discussion we've had.
Talked about, okay.
Okay.
Because that would help. Again, I think that what the doctors have to do in a setting like this is to ask you that very question. They want to always do what the will, to follow the will of the patient. Since your father cannot communicate anymore legally, there's a line of who speaks for him if he can't. And the first one is the spouse. If the spouse is deceased or whatever, then it goes down to children. But legally, she has the right, but you're saying you feel left out of that decision.
Let me ask you this, Jeremy. If I was not in this room, and these people and any medical staff, whoever was here, and I was not within earshot, and they asked you, do you in your heart believe that your father would want to lay on that bed and be kept on this earth by life support when he doesn't know anybody, he can't eat, he can't talk, he can't respond? What would your answer be to anybody else without me being in this room? What would your answer be?
Why
Would
do you
your
say
answer-
that he doesn't know anybody?
Because
I
he
just told
doesn't.
you I saw him.
Because he doesn't, Jeremy.
How
You
quick-
think he does. He
How
doesn't.
fast you're writing him off.
He
I mean,
doesn't.
You're
I'm not writing
You're
him
just
off
so quick
fast.
to get rid of him, aren't you?
I am
You're just
not.
so quick to get rid of him.
Jimmy,
I told you I saw him there.
Yeah.
My decision, as long as I
Not
know
your
Dad sees
decision.
Miss, you
What
just
would
told me
your
what would my
father?
decision
No,
be.
what would your father's decision be? I'm not asking you what your decision would be. I'm asking you if your father. What would your father's decision be? Would you be willing for
Have the
your
chance
father
to see his
say,
grandchild, he'd be here.
Okay. Let me
He's
ask,
still going to be
if he
here.
could hold that grandchild and he could know that grandchild,
He doesn't
would
have to
be
hold
here.
it to see
He
it.
would be here.
Dad can see.
okay. Let me ask a question then. Would you be amenable to, because the crux of that issue, as I understand it then, is can he or can't he?
I've been told he cannot.
And that's what I've been told, but Jeremy hasn't been a part of that.
Jeremy, I mean,
And
you haven't been around, so that I think your mother and your stepmother, and the rest of us who work in the hospital have heard the doctors say that they don't think right now
Yeah.
he's understanding
They don't
and
think.
able.
They don't think yet.
Right.
Okay.
That's to their best medical judgment.
Would
That's
you
what
be
they say.
amenable to having Jeremy sit down with Dr. Murphy and any of this so that
That's
he can
fine.
hear the same information?
It's fine.
that
If
you've
he
heard.
wants me there, fine. If he would like to speak with them privately without my being there, that's fine. I
Okay.
mean, I am willing to do whatever will help Jeremy get through this. I mean, I understand it's an awful thing to be told this about your father. And I understand that when you're living 1,000 miles away, it's even more difficult because you haven't seen the daily progression. But I don't think I am here to, as he says, get rid of his father.
And
I mean, I don't think that's fair, and I don't think it's right, and I will not stand here and allow him or anyone else to say that, because in my heart I
Well,
know that's
just
not
re-
true.
Why don't you just relinquish, like any say-so on Dad, and...
No, I will not
and actually,
relinquish
I will
that.
take care
No,
of Dad.
no.
I'll take care of Dad.
No, I
Because
will
you're not,
not.
you don't seem to be willing to take care of
I will
him.
not relinquish that. I am taking care of him. I have been taking care of
I
him.
think you disagree on how best to take care of him, but I sense from both of you a desire to take care of him. And I think I can trust that in both of you. The question is, what's the best way to take care of him? And I can trust the faithfulness of both of you in that part. If I could draw an imaginary line, Jeremy, let me see if I can do this with you and see if this works. And on one side of it, the doctor says, you meet with every doctor that you want within obviously a reasonable period of time, and at the end of that, you believe there's something inside there that he could interact to a level that he would find acceptable, okay, to see his grandchild, to use those words. Then we would reconvene and talk about that. If Dr. Murphy and whoever else, and at the end of that you say, yeah, I've kind of been caught up to speed, and he's not ever going to be able to interact in any meaningful way that would be meaningful to him, then we would proceed down a different path. Is that an acceptable path for you?
I think that works. I think that works.
Is that acceptable to you?
That's fine for me.
Okay.
Yes.
Patrick, can you think of anything else that would
No, sounds
be
like
helpful there? Because I think we need to, that's the issue that we need to have.
We need clarity,
Clarified.
which none of us can give
Right.
right now. So I think the medical staff, and to be honest with you, Jeremy, there's doctors, when you ask that question about does he know anything, that kind of a question, they will never give you a blank yes or no, because they don't, 100% they don't know. But what they do is they judge by their experience. that, they assume right now, because he's, what they will do is they'll give him purposeful commands. If you take his hand, he might have a reflex to hold on to you. You know, we all have, it's a natural reflex.
Yeah.
What they will do is ask him, move your right hand. If he did that, they would say, he's hearing us, he's understanding us. If he just makes a movement, that does not show mental ability to understand, but they could do that, you could do that yourself when it's over and see what you think. But I don't think you can expect an absolute 100%. Any doctor is going to tell you we're 100% sure. So just so you're aware, you're never going to get that kind of certitude, and I'm sorry you can't. But I don't want to build you up thinking we're going to be able to give you a clear yes and no if you can't. That's unfair to you.
Yeah.
And you deserve that.
Yeah. Okay. That's an important point. Thank you, Jack.
Perhaps another issue just to think about is what is coming down the road. One decision has already been made, the decision for the do not resuscitate order. It's already been made.
Well, no, we haven't. I thought part of this, what I'm agreeing to, is that I'm going to be able to speak with Dr. Murphy and then any other physicians, which I feel which may be able to help with this decision.
The DNR order, to my understanding, is already in place.
Really?
Is it in, one thing I did not know from the data I have on this particular case is it in the chart? I know they talked about it. I don't know if a doctor ever entered it in the chart.
I have not seen the chart, I couldn't tell you for sure, but Dr. Murphy and I have discussed it, and I have agreed to the fact that that would be putting my husband through more pain and anguish. Dr. Murphy explained that frequently when they do this, they break ribs, they could puncture lungs, they can puncture his heart. It is not an easy thing to do, and especially in a feeble person as your father is at this point. I mean, do we want his ribs broken? For what? For him to live for 5 more minutes?
I don't think you're making an assumption.
Well,
Let me talk to Dr. Murphy.
you can speak to Dr. Murphy about it. He
Let
will
me talk
make
to
it
Dr.
clear.
Murphy.
I will find out,
I
because
think
it's unclear to me.
just classic.
It's not clear in the data. I
Okay.
don't either. I'm sorry about that.
Yeah,
Okay.
I'll double check on that when I talk to Dr. Murphy to try to set up a time. Is there a time this afternoon, tomorrow morning, that you could meet with Dr. Murphy? I need to check
Well,
the
this afternoon.
schedule.
Yeah, actually sooner than later,
Okay,
because I'd like to know what's in this chart.
okay.
Sooner than later. Let me call Laura.
Okay.
Just tell her what's going on.
Laura is your wife?
My wife.
Okay, I'm
Yeah.
sorry.
Yeah, she's back at the hotel.
Okay,
But, yeah, sooner than later,
okay.
please.
Is there a number where I can reach you at?
Yes.
Okay.
Yes, I have my cell phone.
Give your cell phone. Okay, can I get that number?
Yeah, 708-327-9223.
Okay. I will get in touch with Dr. Murphy as soon as he's done,
Okay.
and we'll kind of proceed down that course, and then we'll reconvene as we need to, and try to keep facilitating that. And
Yeah,
Jack, I hope your schedule's amenable to that.
sure. That
Okay.
would be possible.
Okay.
And if not if I happen to be off that day or something, one
Okay.
of our people, I can
Okay.
fill that person in and
Okay.
let you know the case it's in.
Okay. Any other questions that you want to ask or bring up?
Well, once this discussion is with Dr. Murphy and
Mhm.
him, then someone will get back to me, or
Absolutely.
what happens next from my end.
Absolutely. You are the legal decision maker.
Correct.
I think it's always hard, and my parents are in Colorado, so when you're coming out of town, you're trying to catch up to where everybody else is. I think that's what I'm trying to accomplish right now. Okay, is just bring everybody up to the same place.
Okay.
And I think, Jeremy, you're at a disadvantage for that very reason, that geographically you weren't here, and so I think we need to fill you in as much as possible. You know, your stepmother's been here hearing all this all the time, and you come in not hearing, this is also new to you.
It's all new stuff.
I'm sorry we had the, I think
Well,
I
I'm
made
also
it-
sorry too. I'm sorry
sure
too
you are.
that I should have never been put in this, to deal with the situation
Okay.
of not being kept aware of what's going on with Dad.
But we'll do our best to bring them to speed, okay? And make sure everybody's on the same page,
Okay.
okay? I will give you a call, and I will also, I've got your number
Yes,
on
you
the
do.
chart. Okay,
Okay,
thank you guys very much.
Thank you, Gary.
Appreciate you coming in for a tough situation. Hey, Jeremy.
Thank you, gentlemen. Thank you.
Thank you.
Okay, Jeremy?
Father, thank you.
Nice to meet you.
Okay,
Thank you.
we'll see you
So
then.
Jack, thanks for coming in, I really appreciate it.
Great, you're more than welcome,
Thank you,
thank
Father.
you. That's good.